Welcome to the Birth Journeys podcast. I'm your host, Kelly Hoff, BSN RN. I am a wife, a mother of two, and a nurse specializing in the care of women and newborns. In this podcast, we will share powerful journeys of birth givers with the goals of lifting the veil on the birth experience, healing through sharing, and beginning an open conversation to strengthen trust and promote transparency between birthing people and healthcare providers. Hello. Today I have with me Dr. Michelle Gerbi. Dr. Gerbi is a mom and baby chiropractor, certified prenatal and postpartum health coach, international board certified lactation consultant, and a tummy time method educator, and holds a number of other licenses and certifications. She is the mother of two, and today she is here to share her birth stories and how that inspired her to physically and emotionally help moms and babies in the perinatal space. Dr. Gerbi, welcome, and thank you for joining me.
Thank you so much for having me. This is so exciting.
I'm really excited to hear the full birth stories because it sounds like you experienced a little bit of everything between the two and managed to have a positive experience, which I think is so key. And what I really want, not necessarily want moms to have all of the experiences, but I definitely want them to have a positive experience for their birth so that it's not something that they look back on with stress, regardless of how it happens.
Absolutely. Yeah. Thank you. I did. I had two really different birth stories. My first birth was just really absolute polar opposite of what I intended, but it still ended up being amazing and really empowering. And ultimately, it really made me focus in on my niche. I've always worked with moms and babies as a chiropractor, but really, really, really commit to working with women postpartum because I felt like, gosh, if I am so knowledgeable about all these issues and have so many resources and so many friends in this field, if this is happening to me, what's happening to women who don't know how to advocate for themselves or don't know what direction to go in? And I really do think the way our healthcare system is set up, we really focus on women prenatally and at birth, which we should. But then I feel like that focus sort of drops off. And that is often when I see, again, we look at things through the lens that we have, right? But that's where I see some of the biggest challenges and hurdles physically, mentally, emotionally that women face. And everybody's sort of moved on a little bit. Like they're there, but they're not. And so that's sort of where my practice has been really focused for the last 14 years.
Yeah, you mentioned that it was an attempted home birth. So I'd love to know what made you decide that, what made you feel safe doing that, and then what happened to get you where you ended up.
So I grew up on the East Coast, right outside of Washington, D.C., and my school was next door to my mom's hospital, and she worked in a high-risk perinatology clinic. So we would literally go to work with her, walk next door to school, walk back to the clinic, listen to the babies on the fetal monitor, watch them do amniocentesis. This is way before HIPAA, right? So we were just kind of in the clinic. And I was like, I will absolutely never work with pregnant women when I become a physician. Heck no. And I thought I was going to be an MD. And I was like, no way, no can do. So long story short, I got really hurt taking a year off between undergrad and college and medical school and broke my neck snowboarding and was really helped by a chiropractor after I exhausted where Western medicine could help me. I was like, well, this is kind of cool. Maybe I'm going to do this instead. So ended up going to chiropractic school. And then in chiropractic school, I still was like, I'm never going to work with pregnant women. And then we had OB class and I was like, oh God, it's genetic. It hit me. I was just like, who else needs hands-on care for musculoskeletal pain that's non-drug and non-surgical? It's pregnant women, right? And all of my classmates were men. All of their partners were having babies. So even in the student health center from school on, I always focused on kind of maternal fetal medicine within chiropractic care. And that's all I've ever done. I'm the worst chiropractor to see if you have an acute knee injury. I'm like, I don't know. But if you have a grade 4 tear and delivery, mastitis, and a baby with colic, I'm your woman. But I'm like, oh, I have no idea about that knee. So I just sort of always focused on all things pregnancy. People would bring me their babies. I went and got trained in craniosacral work. I worked with infants and I just kept learning. I got really into it. I got really excited about childbirth classes. I was certified in clinical hypnosis and really interested in self-hypnosis for pain management. I became a hypnobirthing instructor. And this is all out in Portland, Oregon. And so we're like pretty crunchy out here. And there's a wide variety of, from my understanding, safer home birth options than other parts of the country. It's really well regulated. We also have naturopathic physicians out here who go to 4 years of medical school. They do a 2-year residency. They have full medical licenses. They can prescribe drugs. They can run tests. And so I ended up having a naturopathic midwife as my provider for my first kid. And when I taught childbirth ed, I always said to everybody, I think the safest place to have your baby is wherever you feel safest and wherever you feel most comfortable. And for whatever reason, because I'd sort of grown up in a hospital clinic, it just didn't resonate with me. Like I wanted to be at home. I felt cozy. I felt comfortable. I also was just like, I've got this in the bag. I'm not going to have any problems. I'm broad shouldered, broad hipped. I look like I'm just like made to pop out babies. I was going to the chiropractor. I was doing all my prenatal yoga. I was like, I don't know why I'd have any problems. And I've worked in birth long enough to know that anything can happen. It's not like we have a magic wand, but I felt safe and I felt comfortable being at home. And I really had an excellent provider. You know, I was not into the idea of home birth with somebody who had been in practice for 4 years and was like, oh, trust birth. You know, my midwife had been delivering babies for 20 years and had seen everything under the sun happen and still loved it and did it. And my second, the second midwife, because there was always 2 of them and a student, the second midwife was like a dear friend, my cranial instructor. And I just had all these amazing women. And then my doula was a labor and delivery nurse who was actually one of my hypnobirthing instructors and mentors. So I felt like I just had this amazing crew. I had a really uncomplicated pregnancy. Everything went really well. Labor began spontaneously. I was around, I think I was like 46 or something, like right around 41 weeks. We were talking about like, oh, I'm probably not going to let you go past 41, but labor began spontaneously. And it was so funny because I've heard women say this for years, but I got up to go pee in the middle of the night and walking back to the bed, thought I hadn't wiped well enough and was peeing down my leg. And I was like, oh, I'm going to go pee again. I guess I just didn't empty my bladder. And walking back, felt pee running down my leg again. And I was like, wait a second, maybe my water is leaking. Maybe I'm going into labor. And now that I'm thinking about it, I'm having contractions. But kind of went back to sleep and then woke up and things were really getting going. And because, I had really wanted to do this whole home birth and I had the birth tub and my husband set that up. And for anybody listening to this, if you're renting a condo, don't set it up on the second or third floor. It was a lot of weight. And we had I think we permanently damaged the floor joists when we moved out. There was always this squeak, squeak, squeak. So I was like, oh, nobody ever mentioned that. Probably the birth tub needs to be on the bottom floor. So we set up the birth tub. We called the midwife and I was laboring at home and things were going okay. But I was having a lot of back labor and I knew what back labor was. And we did a whole bunch of different things to try to reposition baby. And my midwife was like, yeah, he's sunny side up. And I think he's a little asynclitic. So his head was a little sideways. We were doing the rebozo and lunges and walking up and down the stairs and different positioning. And I was just having more and more and more back labor. And it was to the point where I was so uncomfortable. And my poor partner was doing hip squeezes every contraction to the point where his arms were numb and the tub wasn't giving me any relief. And I was in back labor for 27 hours. And I was in back labor for so long because I will also say that I'm really stubborn and I still really felt like I was going to have this baby at home. And my midwife the whole time was like, if we can get this baby to turn around, if he'll flip, from sunny side up, you're going to be fine. And we just need him to kind of tuck his head and move. The rest of this will go really smoothly. And she was great. She was monitoring my vitals the whole time. I wasn't in any distress. Baby was doing fine. But over that period, I really just started running out of coping tools. And so that we had done some sterile water papules and you name it. But I was just in agony. And then she said, let's try to start pushing. You're close enough. Let's try to start pushing. You have a little bit of an anterior lip that she was trying to reduce because he wasn't, he didn't have that nice, perfect round head on my cervix. And we pushed it home for about 4 hours. And at this point, I felt like I had been to enough births. I used to attend births as sort of like a doula and, taught enough childbirth classes. Like I knew that my baby wasn't in an awesome position and that it was probably just going to be harder. And I was still up for the job. And my midwife, she knew that I taught hypnobirthing. And when I taught hypnobirthing, I hadn't had a kid yet, but I really, and I still do subscribe to some of the main tenets of it, where being fearful about birth creates tension in our bodies, and that tension in our bodies creates pain, and that pain creates more fear, and this whole circle. And hypnobirthing it sounds so woo-woo. It's really not. It's hypnosis and pain management is one of the oldest accepted forms of pain management, actually by the American Medical Association. But I wasn't expecting to have a pain-free birth, but I did really feel like my body did know how to do this. And, and that I could kind of keep facilitating the process of the baby. And I did have a stumble where my midwife told me, we decided to go push in a different room. Here's where I differ from you, Michelle. I do really think moms still have to push out their babies. And I just remember feeling really disempowered. It was like she had sort of all along been kind of tongue in cheek going along with me in my birth plan, and then was like, well, this is actually how it really happens. And I don't think that she meant it that way. I was just in that really vulnerable space of, I was already exhausted. I was never scared, but I just knew that this was like a harder road. And it felt really disempowering. And so I pushed for 4 hours at home and really still didn't make any progress. And the whole time, probably starting 12 hours into it, she was calling and checking in with the local hospital saying, hey, we've got a mom here. I'm going to send over her charts. We might be coming in. We're not going to come in a flaming emergency. I know what I'm doing. She had a good rapport with our hospital, but I'm just going to keep giving you updates every 2 or 3 hours as to our progress. And so I just at that point was kind of done. And she was like, I just think that like you need an epidural and you need to sleep. And at that point, I would have walked myself to the hospital for an epidural. And anybody who is listening to this and is like, oh my God, 27 hours of back labor at home and 4 hours of pushing. That was just me really clinging to how I thought I wanted to deliver. And, she really was very good about talking about options and, here's what we can do at every stage. And I kept making that choice of like, no, I just really want to be here. I also just didn't want to get in a car at that point. I felt like if I could have walked downstairs and had a full birthing suite at the hospital, that would have been different. Or you could have teleported me, but I also just didn't want to get in the car. And the hospital's like a 6-minute drive from my house. And so she called them and she's like, hey, we're going to come in. And so we get there. And the first thing they do is they do an intake. And then they give me an epidural. And I always said, even when I taught childbirth classes, I was like, don't be the epidural hater. It's a great tool for when you need another tool. You're going to use all these tools and it's just yet another tool. And I was out of tools like mindfulness, meditation, deep breathing. All of that had been out the window for quite a while. And so I needed that tool. And I wanted to marry the anesthesiologist. I still see his face when I close my eyes. And I love him deeply with all my heart because he made all of that discomfort go away. And I will forever be grateful to him. And he doesn't even know who I am, but he was amazing. And so I finally got to rest. I just wanted to rest. I was hoping maybe they could reposition baby and we could try again. And at that point too, my mom lived a couple hours away and she was really freaked out about the idea of me having a home birth. So I didn't want her at home just because I felt like.
Are you pregnant and planning a hospital birth? You don't need a birth plan. You need a birth vision. In my opinion, birth plans set you up for failure. Yep, I said it. Hear me out before you turn off this podcast. You may think that by downloading a generic birth plan, it means you're in control. The truth is, it's not that simple. No one can control exactly how their birth will go. There are way too many variables. What every pregnant person wants is to walk into the hospital pregnant and to walk out with a healthy newborn in their arms. The journey in between is the murky part. It's hard to know what issues might come up that need to be addressed. If you focus your energy on a birth vision rather than giving your power to a birth plan, you can empower yourself to make the best choices for you and your baby. That's why you need to get into my Empowered Hospital Birth program. As a labor nurse and mindset coach, I can help guide you through the process of maintaining the calm autonomy that will help you achieve the birth vision you desire. In my Empowered Hospital Birth program, I will help you identify the source of anxiety you have surrounding hospital birth, fill in knowledge gaps to make sure that you are fully informed and confident, learn key phrases so you can better communicate with your medical team, emotionally process your fears so that they don't hold power over you. Go to kellyhoff.com/empowered to book a free 30-minute private birth vision call, where we will identify your top fears and must-haves and gain clarity on exactly how you want to feel in the birth space. That's KELLYHOF.com/empowered. I'm honored to be a part of your birth journey.
She would just be really nervous the whole time because she's used to having her whole staff and, she did high risk deliveries. But I said, Mom, if I do go to the hospital, I want you by my side. And so when it looked like we were going to maybe go to the hospital, I called her and was like, hey, can you head out? And so she was like 45 minutes away. And she was telling my dad, I guess, she had wanted to call the midwife and see how things were going because she hadn't heard anything. And she knew. She delivered thousands of babies. She's like, something's going wrong. She's like, I wanted to head to Portland. I wanted to get closer to you. And your father told me this was your journey and not to meddle. She's like, but I knew. So she was headed over to the hospital and my nurse was amazing. She was so compassionate. She was like, hey, I'm so sorry that this didn't go the way you wanted. She goes, I wanted to have a home birth too. And ended up at the hospital. She's like, we're going to take really good care of you. And at the time, now I know our hospital staff super, super well, but we were in the process of moving. So I was living where I live now, but still working in Portland and commuting an hour. So my whole practice had been in Portland. I didn't have that close relationship and I didn't have any problem with going to a hospital. It wasn't what had resonated with me. But she was so, so kind. And she was like, we're going to take great care of you here. And I'm sorry your plans fell through, but you're in good hands. And she was just so awesome. And so she said, the doctor's going to come in and talk to you in a little bit and we'll make a plan from there and get you taken care of and have this baby. And so at this point I was exhausted. I had been at home laboring, pushing for, total of 31, 32 hours. And all I wanted to do was take a nap. And so my mom was about half an hour away. I just wanted to sleep. I was so tired. And I felt like I just, without a little nap, wouldn't have any reserves for whatever the next step was at this point. And the doctor walked in and he looked at me and I knew he disapproved of the fact that I had started at home and he just was going to teach me a lesson. And I just had that sense, like he just seemed upset. And so he was kind of gruff with the nurse. And then he just looked through my chart, looked at the strip because I was on the fetal monitor. And he said, well, time to start pushing right now. And I said, I understand that. I said, is there any medical indication that I couldn't please just take a 30-minute nap and rest? I really would love my mom here. This has been a lot. I'm exhausted. I'm too exhausted to even push at this point. Can I just please sleep for 30 minutes? Is there any indication medically that the baby or I is in distress and can't have 30 minutes? Because I'd taught enough childbirth ed at this point to sort of know what questions to ask. And so he looks at the strip again and he goes, nope, you and baby are doing amazingly well. You guys are doing great. And then he looks at my husband and says, but your wife could have a placental abruption and your baby could be dead in 5 minutes. And that was it for me. I knew that was a scare tactic. And I knew, to me, is like saying, well, we could have like a big earthquake. It was really upsetting. And my poor husband had already been through so much. And I just saw him turn white and panic. And I just, more than anything, knew that couldn't be the first set of hands to touch my baby. That was so cruel. And he was like, well, but I'll let you sleep for 30 minutes and then I'm coming back. And he left. And I told the nurse, I said, I don't know what to do. I feel like he's bullying me and he's upset at me. And I couldn't advocate for myself at that point. It took everything I had. And she was so awesome. I love this lady. She was like, you can always ask for another doctor. And then I took a nap and I was like, I'm just going to see how this goes with this guy. And he walked back in and he just had even more gruff energy. And I work within the maternal fetal medicine field, and I work with a lot of physicians and healthcare providers and everybody who works in our field. Every once in a while, you will come across a provider who's usually male who just sort of has weird energy with women. And it's like, it's sort of a power dynamic, and it's kind of like going to keep you in your place or teach you a lesson. And I don't even know if they're aware of this, but that is what I was feeling. And I just couldn't do it. And so I told him, I said, I can't remember exactly what he said, but I just was like, this person cannot touch my baby. No way. And I just looked at him and I said, I'm sure you're an amazing physician. I said, but you can't touch me. And he goes, what do you mean? And I said, I'm politely requesting a new doctor. I said, I don't want you touching me at all. And his jaw just dropped and he turned on his heel. He was speechless and he just stormed out of the room. And my two midwives were sitting in there with me, but they couldn't, they were being very polite. They just were sitting, hanging out till my mom got there. And the nurse was like, good for you. She was just like, she did like a happy dance. She was like, that's amazing. She goes, he bullies women all the time. And this person no longer works in our area. They retired a long time ago, but he bullies women all the time. And we have been wanting somebody to fire him forever. He does that all the time. And she's like, I'm going to get you a new doctor. And so what was really funny is the next on call, the woman who came in, she walks in and she hears our names and she goes, oh my gosh, my best friend in Portland's an MD. And you, Michelle, me, she goes, you taught her hypnobirthing. And then my midwife, she goes, you were her midwife and delivered her baby. She goes, I know who both of you are. Because we had heard from the woman in Portland about her best friend in the gorge. She was a physician. And she was just awesome. And she's like, let's just get this done. We're good. Let's try to start pushing. And I'm going to take great care of you. And she was awesome. And I just really, at that point, was out of coping skills. I was just flat out physically too exhausted. Lou was still in a bad position. He was sunny side up and asynclitic. And she was also just out of her residency. So sometimes I wonder if a really seasoned OB had forceps or could have repositioned him, would I maybe have been able to have a vaginal delivery? Probably the guy I fired was actually skilled enough, but that was fine. I wouldn't have let him touch me. And I remember at one point, I was so tired, I was passing out and nobody was all aflutter, but they were like, oh, let's check her blood sugar and, let's do this and let's look at all these stats. And I just remember thinking in my head, I'm just exhausted. I can't do this anymore. So then she said, I think that your options at this point, really, a C-section is going to be the best idea. And I was like, yeah, absolutely. I agree with you. We've tried again. We've tried to reposition and push, but it's not happening. And that was fine. And my mom was there at that point, and I just wanted to meet my baby. And so she goes, okay, well, I'll call in our surgeon and I'm going to assist him. She wasn't the surgeon though. And we're going to get you taken care of. And the anesthesiologist came back in. He was great. The surgeon who came in was just beyond amazing. He was like, oh, I've got 4 kids. I'm so sorry you were at home and this happened. He's like, we'll still take great care of you. I'm on this stretcher and they're prepping me for surgery. And I'm talking to the anesthesiologist. I'm like, so, by this point I'd slept. I had pain relief. I was like, tell me your thoughts on post-dural scarring and how long do you think it really lasts for? And he looks at me and he's like, what the hell do you do for a living? And I was like, well, I'm a chiropractor and I treat moms. And this is something I see and I'm just curious. And he's like, we were talking about the dura and the tube and where the dural injury can happen. And we're just nerding out. And I'm like, yeah, I'm going to be working out here. And he's like, oh, that's great. It was just so funny. And the surgery went really well, although he was so far down in the birth canal that the next day, the doctor who delivered him, he was really compassionate. He was so cool. He came in jeans and Birkenstocks, again, we're in the Pacific Northwest. And he's like, that was the most stuck C-section child I have ever delivered in my 25 years. And I was like, well, yeah, because I was at home trying to push for 4 and he was really down in there. He's like, yeah, I had to go in vaginally and push him back up. And at one point I could feel my body coming off the table because they were working so hard to get him out. And they had also cut a huge incision because I'm like a size 14. I think they see this, big lady who's a failed home birth and they're like, oh, she must have a monster in there. And, God knows how big this kid's going to be. So then he's like, I could not get him out. He's like, he was so stuck. And I was like, well, that explains things. But he wasn't. He was 8 pounds, 1 ounce. Like he was big, but not huge. They took him, they saw a little bit of meconium towards the end, and they took him and they kind of cleaned him off and swaddled him, and they brought him right over. And my mom was so funny because she was pushing him so close to my face, I couldn't see him. And I was so tired at that point. I remember thinking, like, I'm falling asleep having my first kid. This is crazy. Like, I'm so exhausted. And my mom was holding him so close that I couldn't enjoy him. And I remember saying, like, could you just move him away a little bit? And then could we unswaddle him and put him on my chest? And everybody was like, oh, yeah, no problem. Yeah, of course. And so then they put him on my chest and we did skin to skin. And in the recovery room, I told the nurse, I was like, hey, listen, I was like, nothing about this birth has come anywhere close to what I envisioned. I said, but I'd really love to do skin to skin and I'd love to see if he'll do the breast crawl, which for people listening who don't know what that is, it's like if you put a newborn on mom's chest, they will sort of make their own way to the breast. And from my sort of background and education, it's sort of like the foundations of turning on their nervous system because they have smell and touch and loosely sight, but that contrast and that sort of those primitive movements of getting to the breast, I believe really do help sort of kickstart that nervous system and kickstart a lot of those early newborn systems. And so I was like, if you guys are okay with it, I'd love to do it. And she was so funny. She was so jazzed. She was like, all right. And there's like, 9 people in the room. She's like, everybody stop. Everybody listen to me. She's like, this mom wants skin to skin and wants to do the breast curl. She's like, nobody is to take that baby away from her unless we absolutely have to. And she was like, does everybody understand? And they were all like, like they were scared of her. They were like, yeah, no problem. And then like somebody came over to grab Lou and the nurse was like, what are you doing? And she's like, I'm going to weigh him. She's like, no, he's fine. You can weigh him later. She wants to do skin to skin in the breast crawl. She's like, do it on the baby or don't do it right now. Cause he was fine. And so it was just really, really, really sweet that I felt like I was able to have some win, like I was able to really do that, initiate breastfeeding, and they sewed me up, brought me back to my room, and the hospital staff just couldn't have been more amazing. The only downside with that birth was I got no rest at the hospital because literally every nurse who heard that story came in and thanked me for firing that physician. They were just like, we just wanted to tell you personally how many women we wish would have done that. And I really credit the labor nurse because I was in such a vulnerable state and I was so tired. And I mean, I'm all about medical advocacy and, asking for what you need, but I couldn't think for myself. And when I just told her he's bullying me and she saw it and she just planted that seed, she didn't say you should fire him. She just said, you can always ask for another doctor. It was really her credit. And I wrote her a really nice thank you note months later because I just felt like that could have really gone down a bad road and just felt really traumatic. And the team that came in and how that delivery went, it ended up being really empowering, really, really empowering. And it was beautiful. And then when we got home though, I really felt like I kind of was in between both worlds. I had a midwife for care, but she was over an hour away. And I had the local hospital to follow up with, but I really wasn't an established patient because we were in the process of moving. I had a primary, but they were kind of like, oh, go back and see your OB or your midwife. And so I sort of fell into this gray area and I just had a lot of stuff that most postpartum moms who have a really, really, really long labor or delivery are dealing with, and because I had pushed for so long and they had to go in vaginally, it wasn't like this clean, neat, easy C-section. I really had a lot of pelvic floor strain. I had a lot of pelvic pain. I was having some urinary issues and it was just really hard to move, let alone even get out of bed after that C-section. I had a big incision. I had been on fluids forever because they put me on fluids at home. And so I had like sausage fingers and I was super engorged when my breast milk came in, and couldn't latch Lou, and I was on antibiotics because I was group B strep positive. They'd started those at home. So then I ended up with a bunch of gut stuff and a fussy baby. And we had a lot of breastfeeding issues that were sort of noted, but just kept getting told to try harder or keep going. And I had a ton of milk. My sister, who's also a physician, jokes that we should have been born like 500 years ago and been wet nurses. She's like, you and I can feed the world. And so I had this big fat baby who was doing great. And everybody just looked at that metric of like, she's breastfeeding and the baby's gaining well. So they're having no issues. And I was having 10 out of 10 pain with latching. We had yeast. We had pretty much I had mastitis a few times, and I just really was like, I didn't have anybody to really call with these questions. My midwife had kind of moved on to the next people and was like, oh, you had a C-section, so you really need to follow up with the surgeon for the C-section stuff. She was helping me with some of the other issues, but she's like, yeah, he's a little tongue-tied, but we'll just watch it. He's gaining so great. And it was like, I didn't know who to ask these questions to. Is this level of fussiness normal, or what can I do? Should I be on probiotics? Should the baby be on probiotics? Even though I knew a lot of this stuff as a provider, I was just in this place where I describe after births like that, and I think even just a really easy low intervention birth, it's like you're sort of like underwater, right? Like you're in this really crazy foreign environment and you sort of know you don't belong underwater, but you're still underwater those first, couple days and weeks. And then it's like you get up and you're like swimming up to the surface and you grab a breath of air, but then you kind of are like back underwater a little, and then you tread water. And, I really realized just how much women need help postpartum and they don't get it. Like at the hospital, I had this C-section, a really big C-section, a hard C-section, and lost almost enough blood to transfuse me, but not enough to do a transfusion. So I was really anemic. And I had to ask, can you send me home with an abdominal binder? Nobody told me how to hold my abdomen and support my tummy to cough. Nobody showed me how to get out of bed after having surgery. Nobody gave me a timeline of just, this is how long it should take to heal. A big thing that I really feel strongly about is I think all women who have a cesarean birth should really mandatory go to PT. And I hope in some hospitals that's the policy. But, I have all these women who I've treated forever. Then they're like, oh, yeah, I had a C-section. I'm like, well, did they send you for PT? No. Usually it's like, no. And then sometimes I'm like, did they offer? Well, they said I could if I wanted, but I was doing fine. And my whole big thing with this is that this is one of the last forms of major surgery that we aren't like, oh yeah, you should do PT. Like nobody goes in for a meniscal cleanup or rotator cuff repair. Not only do we know PT is so important, it's mandatory, but now we're all into prehab, right? So, we know you're going to have surgery. Now you got to get strong before. And then C-sections are major abdominal surgery. And we're like, don't get it wet for 4 to 6 weeks. And what a great job. You got a baby. There is no like, here's what happened and here's how long incisions take to heal. And, by the way, you have had 9 months of altered biomechanics and your abdominal wall is out to lunch. Your pelvic floor is out to lunch. Let's turn these muscles on. So I do a lot of that work in my field, but when I'm talking, I sort of say PT or a mom and baby chiropractor. We get that too. But sort of like for the whole country, I would say like women's health PT is the more known niche, but you can do ultrasound to get some of the fluid down. You can talk about abdominal binding. You can talk about exercises and breath work that moms can do in bed immediately those first days after surgery to help move fluid and start healing. And I knew how to do all of this stuff, yet I needed somebody to help me with it. And like nobody was even mentioning this. And I was like, I've got like all these friends, all this support. And I still felt like I was sort of in the dark with things. And, like the first time the baby got thrush, is this really thrush or not? Is it a milk skin? I don't know. Or the first time I've had mastitis, what do I do for this? And just all the little suggestions of, well, now we don't treat mastitis like we did 13 years ago, but, put heat on it and just keep massaging. And like, there's a lot of like gentle cheering on, but there's not a lot of like, here's what's going on. Like I always believe education is empowering, right? So I always I will like nerd out with people about the physiology of stuff as much as they want. I'm like, okay, here's what's going on. You got all these inflammatory pathways activated. Even if the mom's like absorbing half of it, if you understand, that alone is empowering, right? And you don't feel like your body is so much this runaway train of like all these systems, like your milk production is starting and upregulating. And I always tell women, whether you choose to breastfeed or not, physiologically, most women have milk come in. And it's not like a switch that you can just turn off. So the feeding stuff for me is so critical to deal with, not because I believe breast is best and every baby should be breastfeeding. That's great if that's your choice. But really, it's that is the first major issue that women need to face postpartum, that they get either not enough help and support, incorrect help and support, well-intended advice, but not actionable advice. And some decision needs to get made every few hours. So even women, I will work with women who have no intention of breastfeeding, but I'm like, okay, let's go into the delivery knowing the physiology of what's going to happen. Your milk is going to come in. Here's what we can do to help negate that. Here's how we can keep you comfortable so that you're not developing mastitis on day 5 or day 7 and it's catching you off guard. And so I really believe that that is empowering. And for women who want to breastfeed and are struggling, a lot of how I feel we get babies' blood sugar stable in the hospital and get them breastfeeding, it's not always like a sustainable way to breastfeed. Like I tell moms a lot, like how you watch somebody latch a 3-hour-old baby is very different than watching a 4 or 5-month-old baby latch. But women aren't quite in that. They're not ready for that like handoff of like, hey, you're doing better. Here's how we kind of things really go. But they don't always go home, whether they just can't absorb it because it's like there's so much going on, right? It's not, I don't feel like, oh, they don't get this information. It's just we have this void, right? Like somebody I wish could go to everyone's house at 7 days postpartum, 2 weeks postpartum, 3 weeks postpartum and be like, okay, we're going to go over infant care, soothing techniques. Let's see how your breasts are doing. Let's talk about bottle feeding tips. Let's talk about pumping, like whatever you're dealing with, because it just changes so fast. And so that is like, for me, why I got so passionate about feeding, because it's not something that you can like put a pin in and set aside for a few days and then figure it out later. Like you have to keep feeding the baby. And I often find moms won't take care of themselves or address their own needs until that feeding plan is successfully established. Like I have had women rupture discs in delivery, come in dragging their leg behind them. And then until that baby is eating successfully, which my definition of eating successfully is whatever method honors mom's mental health the most, right? Doesn't matter. It's like until mom's feeling good about it, then she'll be like, oh yeah, by the way, I have numbness, tingling, and weakness down into my foot ever since I heard that pop during delivery and I'm dragging my leg behind me. And now I'm like, will you please now go to the neurosurgeon? Like, can we do that MRI? But they won't do it. And so that for me is where like the feeding comes in. It's so critical to help women. And women may have pelvic floor issues. They might be peeing in their pants every time they cough or move, but they're like, I'm going to wear a thick pad. I'm going to figure it out tomorrow. But the feeding stuff, you can't put a pin in. Like if you're going to give formula, then you got to figure out how to pump if you're engorged or, there's just so much there. So after my first, I really, really got invested in the postpartum aspects and helping women recover pelvic floor recovery, diastasis repair. I've developed protocols that I teach other providers of C-section recovery. And always, always, always too, I'm not a mental health provider, but I really address that in terms of suggesting that people, hey, this was heavy, this was traumatic or not. It's just a lot, right? Who's going to address that and who is going to help with the mental emotional component of all of this. So that was kind of my first birth story. And it just really made me recommit within this broad field of sort of all things mom and baby and musculoskeletal and hands-on to really the unique needs of postpartum women. So that's kind of how I got here.
Did you start doing all those things before your second birth and then have like a different experience?
In terms of all those things for myself, like C-section recovery and...
No. So like you said, you were inspired to start working on things like getting licensed.
More postpartum
specific. Yeah, the most postpartum specific for your practice.
So I'd always been a craniosacral therapy provider and done body work on babies, really gentle, non-forced body work on babies. And I'd always sort of treated women prenatally all through pregnancy for musculoskeletal issues and postpartum. But it wasn't until kind of going through it myself and being like, oh, at that 6-week visit when they're like, you're good. And now you don't need a PAP for 3 years. Being like, oh my gosh, things are just getting real. I have so many questions about how often to feed. And I had a lot of feeding issues. We were still dealing with tongue tie and my nipples hurt and my abdomen hurt. So then I got really way more interested in postpartum recovery. And I thought, my gosh, if this is an area that I've worked in for 10 years as a mom and baby chiropractor, and I have a lot to learn, then there's just a lot of need out there. There's a lot of people who want to know, how do I repair my pelvic floor? How do I get my abs strong again? How do I deal with my incision being uncomfortable? And so that's when then I really reached out and trained with some really amazing people who just sort of specialize in some of those more specific postpartum areas. And I would say too, in the last decade, there's just a lot more awareness. There's so much more now. And my son just turned 13. So, that was 13 years ago. There's so much more now than there even was 13 years ago. And so I did a lot of work on my incision. I worked with my colleagues who were chiropractors. I did acupuncture. I worked with 3 different lactation consultants for each of my son to try to kind of like, I was kind of like hell-bent that I was going to breastfeed because the birth had not gone the way I intended, but I was like, I'm going to nurse this kid. And again, just sheer grit and determination, kept going back. What do we need now? What do we need to do? What do we need to figure out? Learned how to sort of rehab my own gut through food, through supplements, and restore balance. And so then 2 years after that, it was really funny. I always wanted 2 kids 2 years apart. And when we would have needed to sort of start trying, I was like, oh, hell no, I'm just having 1 kid. There's no way. This toddler is bringing me to my knees. I'm never having another child. 6 months later, it seemed like a great idea. And we got pregnant with Danny like really easily. And I was like, okay, we're doing it again. And so at that point in our area, some people will try to do a VBAC at home. For me, it didn't feel like a safe option. We don't have a NICU at the hospital near us. And any of the midwives that were up for it, I wasn't comfortable working with because I just didn't feel like they were experienced enough. And I also knew that, I felt like Louis should have had enough room and he didn't. And I was just curious about that. And so instead I went to Portland. So I drove an hour for all of my prenatal work with a friend and provider of mine who's a really amazing OBGYN. And she was just great. She's like, we're going to help you have a VBAC and we're going to do everything we can. I did chiropractic care. I did all the C-section incision work and prep for a VBAC. And my membranes ruptured right at 40 weeks. We went into the hospital and we had a plan. My dad was going to take Louis, who was 2.5. My mom was going to be with me. And the drive in was the longest hour of my life. My husband was like terrified to go over 60. I was like, I'm going to have this kid on the side of the road if you don't pick up the pace. And my 2-year-old asked me more questions that drive. It was like he sensed something would happen than ever. Like he was like, Mom, what do you think that guy's drinking? Look at all those birds. Where do you think the waves are going? Why are the clouds blue? Like rapid fire. And I remember being like, buddy, I'm going to have your brother here soon. Like, could we just be quiet, please? We'll listen to some music. So we got into the hospital and labor began and I was doing really well. Like things felt great and I was really excited and just things were going nice and smooth. But I just wasn't progressing. And I could feel him 6-8 centimeters, kept progressing nicely. And I could feel him kind of like moving and trying to get down into the birth canal farther. And he just was like, he was stuck. Like he just wasn't progressing. And my OBGYN friend, she has a few masters in functional medicine and she also does acupuncture. So we did some acupuncture and stairs and it just wasn't really progressing. And then, everybody was like, well, we could just try a little Pitocin and see if that helps ramp things up a little bit. And I was like, yeah, that sounds good. Let's do that. And I'll let you know if I need an epidural. And we did some Pitocin and I didn't need an epidural. And it was really sweet because at one point I had this nurse who was probably like 23 And she was like, wow, like you're having great contractions. This is awesome. Good job. The Pitocin's working. I just looked over to her and I was like, I want to be super respectful when I ask this, but I was like, you don't have children, do you? And she was like, no, I don't. And I was like, I know that what you're seeing on the monitor looks like great contractions, but I was like, I am reading a book and talking to my mom on the phone. I was like, there is no way what's going on in my body is going to move a child out of there. I was like, we're not doing anything. Like I wasn't even like dropping into the zone, you know, it was like, yeah, maybe on the screen, everything looked great and my body was doing well, but he wasn't budging. And then, so that was like a full day. I was doing fine. And then my friend was really funny when she agreed to see me. She was like, I will come in and deliver you no matter when you're in. She's like, there's one day I can't do it though. So of course that rolled into the one day when she couldn't. And she's like, but my colleague will take great care of you. And so, you know, we were, I think like 20 hours in, and basically everybody was like, well, we could give you an epidural, really up the Pitocin, see what happens, maybe do a C-section if you're not progressing. And at that point, I just had this like innate sense. And I went into it very like, if it happens easily, great. If it doesn't, I'm not pushing it. Like I didn't want to rake myself over the coals a second time. And I was just like, you know, I treat women from the fallout of that, of like, you know, let's just do a big epidural, really up the Pitocin and see if we can just get that baby out. And I just had this innate sense of, I just didn't think he could fit out for some reason. I was like, you know, I just don't feel like that. It just didn't feel like a good plan. And I said, you know, let's just do a C-section. Like, I just don't think this is going to happen. And that was just a really empowering experience. I was able to watch most of it in the overhead lights. They let my mom and my partner in the room because my mom been to tons of C-sections, and they let my mom record the whole thing. The anesthesiologist was also awesome, was picking her brain too about post-dural scarring because I just nerd out on this stuff. And it was lovely. And I said, you know, can we just drop the drape and do skin to skin right away? The C-section was just a lot smoother because Danny wasn't wedged in the birth canal at that point. And he really never, like I never reached to 10. Like I'm totally blanking on the stationing, but he never got super low. And the OB who delivered me, she was great. She's like, oh, I was just reading an article on this. She's like, you have mid-pelvic dystocia. And she looks at my mom and she's like, we think it's genetic. And she's like, did you have C-sections? And my mom's like, I had 2 and I was a nurse midwife. I was hell-bent on having a vaginal delivery. And what's really interesting is my sister went on to have 2 C-sections with like 6-pound babies, you know, and attempted vaginal deliveries, but just both times it wasn't happening. And so she's like, yeah, you've got mid-pelvic dystocia. She's like, you just can't get past these bony landmarks in your pelvis. And it's fascinating. She's like, but I think that's what's going on here. And that just made so much sense to me because I could feel him with the contractions. Like you know, as a body worker, I have a really good sense of my own body. I could feel him moving. I could feel him trying to tuck and trying different positions. And it was like he just kept butting up against something. And so it was just really fascinating. So then we lowered the drape and it was just so funny because I just saw this little purple baby with one eye open, and he saw my nipple and reached out with a hand and coming in, grabbed my nipple as they were putting him on my chest. And I was like, wow, God, if that's not like biology in action. It was like his landing zone, you know, like he just was like, boom. And it's really funny because he's my kid who still will just like hug me and the hand comes over to the chest. And I was like, he was my kid that I was like, oh, if I don't choose to stop breastfeeding now, we're going to be nursing a 4-year-old, you know? And so when it was like innate since birth, that kid was just like, you know, here I am. And again, they let me do skin to skin. They let me do the breast crawl. It was just a really, really empowering, beautiful, amazing experience. And the recovery was so much easier. Even though I had a toddler at home, I hadn't physically pushed myself past any known limit 6 times. And that's what whenever I have a mom who had a really, really long labor turned into a C-section, I always say, yeah. And the crazy part is that you've gone harder than you ever knew you could physically. And then you keep going. And then you hit another whole new level of going past any point you thought you could physically. And then you keep going, you know, and then you keep going. And they're like, yeah, exactly. And then you have major surgery, right? And I think that's just such a rough, depleted place to start from that I didn't want that with my second. Nobody who's going to have a hip replacement that's like scheduled for Friday is like, well, starting Wednesday, I'm not going to eat. I'm going to go run around and stay up, throw up every few hours, not feed myself, all in the name of prepping for surgery. And I think that's like another little missing link from the whole C-section thing for women that have a trial of labor ending in a C-section. And again, all of my choices were self-inflicted. If I had asked the midwife to take me in after 10 hours, she would have. But I think a lot of women just don't know how that ship is sailing, even in the hospital, just working with lots of women who are having a planned vaginal delivery in the hospital. So the second one was just so much easier to heal from. I didn't feel so chewed up and spit out, and which was good because I also knew I had a toddler to take care of. Like I knew I couldn't be in such rough shape. And we had every breastfeeding issue under the sun again. I was like, this will never happen to me. I know so much now. I'm not going to slide through the cracks. And I was like, I want to see the lactation consultant. And my first labor and delivery nurse, she was like, I am a lactation consultant. He's good. He's latching fine. He's not tongue-tied. Don't worry about it. Keep practicing. I was like, no, something's wrong. I shouldn't be bleeding and purple trying to latch this baby. And I said, I want to see the head of lactation. So I saw the head of lactation. She came in. No, he's fine. He's not tongue-tied. Keep going. Keep practicing. And again, this is 10 years ago. Things have changed. I was like, no, I want to see the pediatrician. I was like, I do this for a living. I work with tongue-tied babies. This kid's tongue-tied. My first was tongue-tied. I couldn't latch him at that point. My nipples were so shredded. I had to use a shield. He had no suction. Pediatrician came in, said, no, he's not tongue-tied either. Just keep trying. I called my colleague, who is the head of the Oregon Board of Lactation. And I said, nobody will believe me that this child's tongue-tied. I'm starting to doubt myself. Can you please come in as a friend and assess him? And she was like, Michelle, he's super tongue-tied. Do you know what you're doing? And then she got me a referral on our way home to a big ENT in Portland who was like, yeah, this is one of the worst cases I had seen. And he was continually losing weight despite feeding him constantly. He couldn't clear his bilirubin. He was still jaundiced. His oral motor patterning was disastrous. And I always go for like sort of a watch and wait. Let's see how you're doing. Let's try all the conservative interventions first. And I had enough clinical experience that I was like, we can wait for this train to go off the rails more, or we can just move forward and I can start healing and enjoying my baby. And so I just opted to do the procedure then and there at day 5 or day 6. And then we went on and breastfed fine. It was great. And I know that there's a lot of different opinions flying around about it, but I share that as another example of if you don't know the questions to ask or advocate for yourself with whatever situation, that there may still be stones to turn over or things to think through or think about. And if moms don't know to sort of trust that instinct that something is still going on and keep seeking out answers, I think they can kind of become disempowered or fall through the cracks. And, if I had no medical background and didn't do that for a living, and I had 3 IBCLCs and a pediatrician all look at that issue and say, no, that's not what it is. Why would you ever keep looking? And why would you ever you would just go, well, yeah, they just said, some women have pain with nursing and it just isn't any better, and not know to keep seeking out answers. And thankfully, because my provider was a friend, I was able to sort of share my experience with the breastfeeding and how motivated I was to breastfeed, right? I really wanted to breastfeed that kid and not have 3 months of pain and mastitis to do it. And so thankfully, she was really open ears about it. And I was like, hey, can we invite someone to the unit to help train the nurses and the staff and better identify and assess and go over the most evidence-based grading scales? And the provider who had done Danny's release, he was really willing to come talk. And that was fantastic because everybody got a better education in it. And, I felt like if I could help another mom, even if somebody were to just say, I don't think this is it, but I don't know, or here are other ways to look at this, or here is another set of tools, but it was just very like, nope, that's not it. And so that is something that I really try to instill in women is I think as moms, we have this sort of innate instinct in how things are going or not. And I always really try to cultivate that instinct in mothers and, really have them not disregard what the medical system is saying, but to also take what they're saying and tune into your own sort of innate wisdom about how you think your baby is doing. Both ways, right? Because I've had providers be like, no, this baby's fine. But the mom's like, something is wrong. Like something's going on. And it's beyond, and sometimes moms have severe postpartum anxiety, right? And you're like, this is like just a raging mental health issue. And let's help you with that. But other times I've seen those moms be really correct and they keep seeking out answers because they just knew in their gut something was off. And I think that is like that piece of us where we're mammals, and mammals are tied to their young and mammals know how their young are doing. And that's how all mammals survive. Like, I think we have sort of this wisdom in us. And if we can, as healthcare providers, help cultivate that. And I think that you do a lot of that, like just looking at some of how you talk in your podcasts and, when the things you put out there, with birth, it's that blend, right? Of just listening, but also balancing. So.
Yeah, absolutely. I think that the more informed we are, the better we are going to do, but also the more we are able to talk about the things that are coming up for us, the easier it's going to be to communicate with our team and find people that can help us.
Absolutely.
I really think it's so interesting. What's coming up for me since tongue tie is the last thing you talked about is there is such a controversy, I feel like.
Oh, yeah.
Like, why? I mean,
oh gosh, we should do a whole separate episode on that.
But why do people deny?
I know.
I see so many babies that I look at them. I used to just be like, oh, I don't know, because people would tell me, oh, you're a nurse, you can't diagnose a tongue tie. So now I don't diagnose it. I say, something looks funky. Maybe you should ask someone about it. And if you're having pain with breastfeeding, continue to ask about it. And that's what I can say without having a diagnosis. Yep. But if the tongue's not coming out perfectly, or even if you can't see the tongue tie, because you can see if it's too far
those
forward.
Heart-shaped tongues. And,
yes.
Yeah.
Like, you know it not.
I know. So there's a big thing where, now we have anterior ties and posterior ties. There's been a lot of debate over the grading scales, over who has the best grading scale. There is accusation of overdiagnosis and overtreatment, of it just being a money-making vehicle. I used to teach courses for people on how to identify tongue tie, but the way I look at it is, I do think actually my C-section, right, this sort of genetic predisposition in our pelvis, one of the more compelling arguments I've heard is that we're a few hundred years into now clean water, good baby feeding devices, and decent formula, right? And if you were so tongue-tied that you couldn't eat 500 years ago, you more than likely weren't going to make it, And so I do think that this is a trait that is not getting selected against anymore. And so I do think that is reasonable. If we're just going back to like evolution 101 and science and biology, you're going to see those traits not be selected against. You're going to start seeing more of them. I mean, that's just how genetics works. I'm oversimplifying it. So if you're a geneticist listening to this, don't get mad at me, but you know what I mean? Yeah. So I think that's a very real kind of component of it. And then I think the hard part is that what I always say, and when I teach about this, is I always say it's a functional diagnosis, right? And so you need to put your hand in the baby's mouth. You need to palpate the muscles around the jaw. You need to feel how the tongue is moving. You need to check the reflexes of within the mouth. And you need to watch the baby eat. There's kids that are really tongue-tied that can still functionally nurse because they have a lot of elasticity in that connective tissue. There's other kids that have a tiny little tie and are doing terribly. And so I always really, when people say, oh, they looked and they said it wasn't a tongue tie, I'll say, well, then when they saw the baby feed, what did they tell you? And they'll say, well, no, they didn't watch the baby feed. And so to me, and this is, again, we look at the things through the lens that we have with our professional certificates and degrees. But for me, to say that a baby is or isn't tongue tied without putting your hands in their mouth, assessing the tongue and watching them eat is like me looking at somebody that might have a nasty purple ankle and just saying, yeah, yes or no, that's broken. It's like, well, that's a good guess based on what I can visually observe. But we have really good, the Ottawa ankle rules, and we have imaging, and, so you can actually test it and feel it and move it and watch the person walk. That's going to give you, do vibration. That's going to give you much more clinical information to know, is this really broken or not? That's not like a great analogy, but there's just so much more that can be done. And my other big thing too, that I always say is, there's 10 different things between both mom and baby that can impact feeding success. And anything that involves an intervention, like treating a tie, for me should be bottom on the list. But if we've done all the other 9 things and mom's really motivated to breastfeed and this is the last thing that's there, then why are we not treating it? Another big thing that I haven't heard talked about, but I see in practice and when I connect with my colleagues, a lot of my continuing ed that I stay up on now is really more within the world of like neonatal OT, neonatal PT, feeding specialists, lactation. But if you talk to people who've been working hands-on with babies for the last decade or two, we have more babies with more fragile nervous systems is what I would say. I see more babies that are just a little lower tone than I would like, or a little too high tone than I would like, or that tongue doesn't have great stamina, or their reflexes are a little sluggish. And we just have these more delicate nervous systems. And so I also think that it's a culmination of looking at that whole baby and like the integrity of that baby, like how are they actually doing? And I think some of these horror stories that you hear are that the baby has something else going on too. And yes, they may have a tongue tie, but treating just the tie isn't addressing it. And if I had $1 for every kid that, even when we're going into the tie, I'm like, okay, I think this is what they need to breastfeed. However, we've got a little bit of a flat spot because we don't have as much neck tone as I would like. And we're going to work on all these other things. And these kids sometimes graduate to like what I lovingly call the best worst nurser. And I'll say to them, hey, listen, when this baby should start making bowel sounds if they're delayed, or when we should see them rolling or crawling if they're delayed, and anybody else tells you, oh, let's just watch and wait another 3 months, I always say, no, come back and I'm going to refer you. And we're going to go in and we're going to go get an OT workup or a PT workup, and we're going to start early. And I think that there's so much amazing development going on, and we can take advantage of these nervous systems being so malleable. But sometimes I think that these manifestations of feeding issues are the first manifestation of a nervous system that it's either going to need more help or be a little more fragile or just need a little bit more coaxing. And so I think that really muddies the clinical waters, right? And then we're also in that 15-year gap where we say that between research and clinical implementation is like 15 years. And that's like what I've really witnessed is the research is really there to support the origins and the etiology of tongue tie, but the clinical adoption is hard. And the other part I think is really tricky is a lot of physicians, I feel so badly for them because their main outcome marker that they're sort of told to look for, like in a pediatrician's office, is weight gain, right? And so if the baby's gaining okay, but there's no other indications, like they don't really know how to advise moms. And they don't know how to say like, oh yeah, I get it. This kid is slipping off the breast a ton and this is looking really sloppy. And what do we do? And so I think that's a tricky part as well.
Yeah, I agree. And I also feel like the issue with specialization silos, like you're only looking at the ENT aspect and not you, but I think that it doesn't cross over. So when you have somebody like you that looks at all the different things and is able to look at the whole baby versus just looking at the tongue tie, I think it's really important because everybody's just really specialized now. And that is good and also bad because you have a whole body to work with. So.
Yes. And and with moms and babies, you have to look at the whole package, right? I've had moms come in for a tongue tie consult and assessment, and I'm like, I see this tie, but you have no milk. Your supply is in the toilet. That's what's causing what I think is the tip of the iceberg of all these feeding issues. And now, we can like do a whole episode on what caused low supply. Was it inadequate removal secondary to the tongue tie? But I think if you just have a provider who's like, oh, you don't have enough, let's clip the tongue. And then the baby doesn't have a good outcome because there's no positive reinforcement at the breast because there's not enough supply, that person isn't going to have a good outcome.
Yeah.
You really do have to look at both of them. And I think what's really hard for the nurses is their hands are tied. They see it a lot, but they're not allowed, like you said, to diagnose. They get their hands slapped, and the MDs, I will just say, I think are not the most savvy at the functional diagnosis of oral motor mechanics because they don't get a lot of education in it. And I have some really amazing colleagues in this area, and they're like, yeah, I want to learn, like, let's talk through it. But it's also really hard if you're a speech language pathologist or a neonatal OT or a chiropractor to say, hey, do you guys want to learn from our community? Some MDs are really open-minded, and others, I think, because they're used to sort of being the top of the food chain, feel like they know enough. And if it's not their clinical interest, it's not something they focus in until they have a baby and they have breastfeeding issues. And then they're like all over it.
Mm-hmm.
You know, they're like, I really want to learn more. This is fascinating. And so, yeah, I think that's a piece of it too. And I don't blame the physicians. Like, I stick up for them every day because I have moms coming in saying, why didn't they do this or that? I'm like, the healthcare system is really overburdened. They are stuck in a system that's really dysfunctional. They're not given, even if they want to watch you breastfeed, I doubt they get enough time to watch you breastfeed. They're probably allotted 6 minutes for your visit.
Mm-hmm.
You know, that is not their fault. And
Right.
so that's a big thing I want people to hear too, is that, you know, rather than doctor bashing, you need to just seek out additional information. You just need to seek out other providers who can take the time to really suss those things out. But it's hard to put that burden on the physician when the system won't give them that time.
Yeah, that's why I'm really fascinated by the thought of how can we start catering to low risk birth and low risk patients so that we can have people that specialize in being able to not just keep someone alive.
Yeah. Yeah.
The high risk centers are there to keep people alive, which is great.
Yeah.
I love that. But we've neglected the people that are thriving in life.
Oh my gosh. Yes, I say this all the time. We have amazing sick care in this country. And
Yeah.
the sick care has gotten even better, but I feel like it's been at the expense of healthcare. And then
or wellness.
what
Just like,
makes
why are we not focusing on
wellness,
keeping
like
people
true
well?
healthcare. Yep.
Yeah.
And then I feel like people have to pay out of pocket for like your services and my services as coaches. It's not
Right.
covered, but we have the time and energy to do this. And that's why doing things like taking the time to come on this podcast feel really important, because I want to have information that is free for anybody to listen to, you know, and even in my coaching business, my longer term plans are to have a 501c3 so that for every course that gets purchased or every woman who does have coaching, I'm donating. I feel like it shouldn't be something that's just available for people who have the disposable income. You know, it's like, this is information that should be accessible for all women across all demographics. And I don't think we can look to the traditional model to fix it. You know, I think it's like, it's gotta be like these smaller grassroots movements that slowly pick up steam, and people who just really want to see women succeed and thrive. And you and I both in our businesses have seen it. You just see women who may go into birth so empowered and they just get so rocked, and it negates their confidence and their ability to take care of the baby. And they just go into motherhood feeling so caught off guard. Right. And it doesn't have to be that way. And they're caught off guard, and then they feel lost, and then they have this total crisis of confidence. And they just feel like, I'm not even cut out to be a mom. I don't even know how to do this. And I think just good education and saying everybody struggles at some point. We all have low moments. We all go through this, like normalizing some of it, but also having really actionable resources. And that's where you and I are both saying the healthcare system is so attuned to, if your baby has a congenital anomaly and needs surgery, no problem. Like, this country is amazing at that. But if you're in that gray area of you're not sick, but you're not thriving, we've got nothing for you.
Yeah. And what I love that you brought up the 503C?
A 501(c)(3).
501(c)(3). I'm like, what are the letters and numbers again?
I might be butchering it too.
Yeah, because I have spent, gosh, I don't even know how long, like probably 30 years working in making sure that people that don't have resources get the resources. So to start doing something like coaching is so foreign to me that
Me too.
The only way that I can do that is to say I'm catering to people that have the resources so that I can later help the people that don't have the resources. Because I look at this as I didn't have the resources when I was pregnant with my kids. I wouldn't be able to afford a birth coach.
Me too. No, me too. I wouldn't have been able to afford a postpartum coach.
Yeah.
But it's doing this, then we can take that and help more women. I love the community that we both work in, and that, you know, it really is about women helping other women and women empowering other women. And I've met so many amazing providers and mothers, it's great. And it's fun because, my main degree is in chiropractic care, and it's a very male dominated field. And you go to conferences and it's a statistics and numbers and what are you billing and what is your AR? What are you collecting? And it's like, does not get me excited the same way that like watching somebody who really struggled to call me and be like, we're breastfeeding, or I'll bump into someone at the grocery store and they had a 5.5-pound bird baby and a C-section and all these struggles. And they saw this like giant 6-month-old who's in like 12-month clothing. And they're like, can you believe how, like, this is so cool. And like, that is really what gets me excited. And I do think that there's ways with creative thinking to sort of help rebuild the system, but from the ground up. And even like I used to own a big medical practice with other physicians and providers, and we build insurance, and the medical system wants chiropractors to treat acute issues only. Everybody should get better in 4 to 6 visits, and your visit shouldn't take any more than 10 or 15 minutes. Well, like 10 or 15 minutes, like someone is crying or needs to be fed in my office. Yeah. And, when I sold my big clinic, I stepped away from the insurance world. And that was really hard for me because I do want people who can't afford my services to still be able to come in. But I told everybody it got so bad that I had to leave medicine or leave insurance. And I love practicing medicine. I didn't want to leave it. But, I do have a sliding scale and I donate my time, and I'm able to do it in different ways, but it just took some creative thinking. But it was that bad. It was like I had to separate from it because my demographic of clients I can't serve in 4 to 6 visits, in 10 to 15 minute visits. We're just getting into it.
Right.
So
yeah, that's so great. That's why I love talking to women that are also entrepreneurs, because we put our heads together and figure out how to help other women, other moms.
Yeah, it's scary. It's scary at times. It's like, is this really going to work? But at the same time, it feels really good to be able to help other people. Yeah.
I have a couple things that I wrote down. I love your analogy of feeling underwater after delivery. I felt the same way. Even though I was a postpartum nurse when I had my daughter, who was my first, I was just floored by how much I didn't know, even though I had prepared. And then with my second, I prepared for the birth, but then afterwards, I wasn't able to really navigate the breastfeeding alone, even though it was my second. It was fine. Yeah. I did fine, but I still had questions. I still was like, well, this isn't working as well as I wanted it to. He's feeding every 5 minutes. Why is this happening? And I found myself texting my friends, and I'm just like, my gosh, how do moms that don't have the resources and the friends that I do any of this? It seems impossible.
I know. Yeah. I felt the same exact way. I remember watching one of my best friends, who's a labor and delivery nurse in an IBCLC, curling her toes, telling me breastfeeding her son was going great. And I was like, you're miserable. You're having a ton of pain. And she just started sobbing. And she was like, I know. She's like, but I feel like I should know all this and know how to do it. And I was like, it's okay. Like we can park all of that. And, but if those of us who are in this business are struggling, I'm always just like, God, just imagine what every other mother is going through.
Right.
And how much help that women need. And I think it's just hard because I've had friends who've had births in other countries, and they're like, oh yeah, well, a nurse comes to your house, and there's community lactation support and free clinics, and we send doulas, and it's just our system is not set up for that, and it's like I feel like the pediatric, like the baby has a pediatrician. If they're gaining okay and meeting their milestones, then they're fine. And then mom's cut loose after 6 weeks. And that's when I think most of those things just start snowballing.
Well, and
they just don't know who to go to.
Yeah. That's where my doubt came in, because people that I respected were telling me that everything was fine. I'm like, okay, well, maybe it's just me. So I just discounted
or we say
what I was
it's
thinking.
Normal. Yeah, we say it's normal, but I always say just because it's common doesn't mean it's normal. How many women, are like, I still feel a lot of pelvic heaviness or fullness, or I'm having hemorrhoids. And we're like, oh, it's normal. I'm like, no, it's common. It's common. It's not normal. And normal. There's actually stuff that you can do to treat it. So many things that we tell postpartum women in their own bodies: carpal tunnel, nerve pain, chronic headaches. Oh, it's just common. You just had a baby, severe low back pain. Well, it's normal. It's normal. It's like, no, it's common. And it's actually super treatable. It's really actionable. There's a ton of things you can do for free at home. but you just need the information. So that's my goal in launching the coaching, is to get that information out there for people.
I love that. That's amazing. There's so many things that I want to talk to you about, but I know that you have to go and my kids just came home.
We'll stay in touch. Okay.
Is there anything else that you wanted to say before we wrap up?
Oh, I think that was it. Thank you so much for having me. This was awesome. This was a lot of fun.
Yeah. Thank you so much for coming. And I'm excited to talk to you about more fun things in the future.
Me too. I'm excited to stay in touch.
Thank you so much for tuning into my podcast. If you enjoyed what you heard, make sure you hit that subscribe button so you don't miss out on future episodes. Don't forget to share the podcast with a friend who can benefit from the valuable insights that we share here. And if you could take a moment to leave a 5-star rating and review, it would mean the world to me. If you're ready to work one-on-one with me to embark on a transformational journey towards a confident and empowered hospital birth experience, go to kellyhoff.com/empowered and enroll in my Empowered Hospital Birth Coaching Program. Together, we'll create a roadmap to a birth experience that you'll cherish forever. That's KELLYHOF.com/empowered. Let's make your birth experience extraordinary.